I am working with the health team here in Rio Caguan to undertake the activities of a health brigade, which is a mobile clinic that moves along every 2 days from village to village to provide basic primary health care for communities who do not have access to health. It's an area that has been throughout the past 20-30 years in control of the armed groups. Government institutions have never actually had access to this area. Therefore, it is seen as a red zone, as a zona de conflicto, a conflict zone, and therefore the doctors and nurses are scared, in fact, to come and work in the area. People cannot get basic healthcare here because of the conflicts, because of the distance. The vulnerability of the communities is due to the fact that the health services in the area have not been provided for a very long time. So yesterday in the clinic there was just a child who is suffering from pneumonia, and their family has been waiting for the past 15 days to consult with a doctor, and these are the kind of cases that come across the health team. And the Health Brigade of the International Committee of the Red Cross does mobile health clinics on 8 ports, in fact, along the River Caguan every 4 months. In fact, and logistically it's a bit of a nightmare, as you could imagine, and taking all medications from Bogota, and with about 10-15 personnel team, it takes about 7-8 hours to get to the destinations, and you have to discharge everything, you have to prepare the whole setup. Of course, there are not many health infrastructures, so everything has to be done from scratch. One of the key concerns, in fact, medically speaking, the high number of teenage pregnancies, the number of children 13-14 years old who are getting pregnant. This is a low-intensity conflict. The basic services for the communities have actually been destroyed. Communities are not able to function properly without proper healthcare, without basic education. It's a very long river. There are about like 500 kilometers all the way to the last point where we reach. And that takes more or less for the people about 2 days to go to a hospital, in fact. Frankly, the communities in this part, the lower part of the Rio Caguan, health-wise, they are living in a desperate situation. They really do not have access to a doctor, a nurse, they do not have access to medications. The smallest hazard, the smallest risk could actually become a big thing, in fact, medically speaking. And that's exactly how desperate the situation is, and that's exactly the kind of job that we are doing. Whenever I talk to them about the issue of health, and they say, in fact, that they feel as if they have no right to get sick or to get ill.